to talk about case reports. I think it's documenting the care of individuals that we've talked about a lot here, but I think it's really important, and I think it needs to be done in a new sort of way. And I started a medical journal, co-founded a medical journal with Michelle Middleman here from Boston 2 years ago. Case reports go back a long way. This is one that I found on at the National Library of Medicine, an oncological case report from 1550 BC from Egypt. So case reports have been around for a while, and of course, they used to be the mainstream of literature. Now, if I had a little bit more time, I'd hit the play button on the bottom of this slide. You'd see this infantile hemangioma go away. It was published in the New England Journal of Medicine as a letter to the editor in 2008, and that treatment, propranolol, is now a mainstay. So most people think case reports are ignored in evidence, but the two of the fathers of modern evidence-based medicine say without clinical expertise, practice risks becoming tyrannized by evidence. And Gordon Guyatt says that high-quality evidence doesn't necessarily mean strong recommendations, and that low-quality evidence can yield strong recommendations. So it changes. And what are they? Professional narratives that can be used for medical, scientific, or educational purposes, and they can also begin to help control costs, provide evidence. So let's talk about a few definitions. Clinical trials, randomized controlled trials, use an artificial environment and measure efficacy. Case reports measure effectiveness. And what I really want to do with this, besides publishing case reports, is begin to develop data registries of systematically collected data from all patient encounters everywhere in the world so that we can begin to scale to hundreds of millions of cases. I'm not anywhere near doing that. Case reports, I publish a medical journal, so I'm at the tip of the iceberg. Case reports have problems. They haven't been systematically reported. And of course, there is the causality issue around N of 1 trials. I might point out that medical journals only published case reports up until about 1950, 1960. So we launched an initiative with some of the leaders in reporting guidelines to develop the care guidelines for case reports. So we ended up getting a 13-item reporting guideline, and this is it here. It's kind of probably hard to read, but I have sticks for everybody if they want, USB sticks, the people with this on it. Beginning with usual things like the title, keywords, abstracts, introduction, patient information, clinical findings, timelines. Big thing on a timeline. Then also having diagnostic assessment, therapeutic interventions, follow-up and outcomes, discussions. We added patient perspective in there. And all case reports are supposed to have informed consent. Then we took that guideline and we converted it into a checklist. Everybody likes checklists. So this is theoretically, it's a 13-item, but you can see there's a lot more than 13 items there. But it sounds good when we say we have a 13-item checklist. And then we kind of got lucky. We published this in 7 medical journals simultaneously in September. BMJ, Deutsche Ärzteblatt, Journal of Clinical Epidemiology, Global Advances in Health and Medicine, the journal that I'm the co-founder of. It's now on the Equator Network as one of the key reporting guidelines. For those of you who do clinical research, you should know about this website. It's where all the reporting guidelines live. We also launched our own website for this following the usual acronym called carestatement.org. And so we have all the checklists, writing templates for case reports, and things like that there. You'll find that most reporting guidelines, Cochrane, Quorum, Prisma, Strobe, for those of you involved in clinical research, there's all sorts of ways to improve the quality of reporting. So I think these individualized data sets are key. And I think that we can begin to get new insights. And we all know that practitioners and consumers are now able to consolidate data. And I think that this new flow of data over time will transform how we think about data. It already is from all the personal health monitors that people have. And as our effort needed to produce high quality data becomes easier and the rewards more tangible, then the way we look at observations are going to shift. So case reports are growing in interest. 252 medical journals publish case reports these days. Big increase. It's the strongest growing area in the National Library of Medicine right now. So I think that systematically written case reports can offer information that will improve healthcare. When care improves, everything gets better. Patients are better served. And I have a journal that is trying to do this and push that, and we're working with BMJ Case Reports, Journal of Medical Case Reports from BMC, so these are the 3 biggest journals doing case reports these days. Ended with a quote from David Sackett. that the practice of evidence-based medicine means integrating individual clinical expertise with the best external evidence, and that both are necessary. Thanks.